Hello, my name is Dr. Diwan S. Raja. Today I will discuss about Pseudogout. What is Pseudogout? Pseudogout is also called calcium pyrophosphate deposition disease. This deposits in the cartilages inside the joint. This is a type of arthritis that occurs when calcium pyrophosphate crystals accumulate in the joint, particularly in the articular cartilage. Etiology or causes: it may be sporadic, hereditary, genetic, or secondary. A few cases are autosomal dominant. Predisposing factors causing secondary pseudogout include history of trauma, hyperparathyroidism, hemochromatosis, and diabetes mellitus. Okay. It may be associated with chronic kidney disease. Crystals in pseudogout: the crystals are made of calcium pyrophosphate dehydrate. These crystals can trigger an inflammatory response in the joint by the interplay of the inflammasome of the macrophages. So, if we look at that, this is the histopathology of the pseudogout deposits. By hematoxylin stain will get this appearance. Okay. Like rounded, irregular appearance and red color. If we draw the fluid and we look at if we go through the aspiration of the fluid from the joint and we study the smear, we'll get the crystal. Crystals are rhomboid shaped crystal. They are positively birefringent. Pseudogout symptoms: pseudogout may be asymptomatic. It can cause symptoms similar to other forms of arthritis, but usually not like that of the excruciating pain of the gout. The pain is comparatively less when we compare with that of the gout, but there is certainly eventually the development of pain, swelling, and stiffness in the affected joints. It often affects larger joints such as knee joint, maybe ankle joint, maybe elbow joint, shoulder joint, wrist joint. Risk factor: age is a significant risk factor for pseudogout. It is more common in individuals over the age of 50. Other risk factors include history of joint trauma, certain metabolic conditions like that of the diabetes mellitus, hemochromatosis, like that, maybe hyperparathyroidism, and some genetic factor. So, in case of genetic factor, what happens? There will be damage to the degradation to the proteoglycans in the cartilage that will invite calcification, and also the pH of the soluble fluid of the joint will be altered. So, you get these are the risk factors of the pseudogout. Diagnosis of the pseudogout involves clinical evaluation. Imaging studies such as X-rays will get calcification in the cartilages due to the deposition of the crystals. Okay. And here, analysis of soluble fluid extracted from the affected joint, presence of calcium pyrophosphate crystal in the synovial fluid is a key diagnostic indicator. Treatment for pseudogout aims to relieve symptoms and prevent further crystal formation. NSAID, non-steroidal anti-inflammatory drugs, are commonly used to reduce pain and inflammation. In some cases, joint aspiration may be performed to remove excess fluid and crystals. Medication include colchicine, what we used in gout also. Also, corticosteroid may also be prescribed. But there is no medication or drug which can prevent totally pseudogout. Okay, so it is mostly relief of symptom and prevent further crystal formation. Okay, that may not be perfect always, but maybe it may slow the process of crystal formation. Prevention measures include managing underlying conditions that may contribute to pseudogout, such as hyperparathyroidism, hemochromatosis, management of diabetes mellitus, management of chronic kidney condition. Okay, staying hydrated, taking a lot of water, and maintaining healthy lifestyle like physical exercise, walking in the morning or evening, or both, can also be beneficial. It is important for individuals experiencing joint pain and other symptoms to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. And that's all about pseudogout. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.